A new kind of therapy is finding its way into hospitals all across the country. And Judy, I know you've been taking a look at this, right?
I have, Olivia, and I think you're going to be very interested in what I found out. Greenwich Hospital in the Connecticut suburbs northeast of Manhattan is big and impressive, with all the high-tech modern medicine you'd expect in a place like this.
Hi, my name's Beth, and I'm a Healing Touch volunteer here at Greenwich Hospital. How are you today?
But it's also integrating into its services a treatment that relies on healing at a very basic level. Laura Sorgenfrey is recovering from hip replacement surgery, and she's had better days.
Many of the patients, at a minimum, they find it very relaxing, but for some patients, it can help them with pain and discomfort. Some patients find it helps them with anxiety.
That's kind of where I am right now, pain and discomfort.
Yeah. Did you sleep last night?
No, I didn't sleep well last night at all.
It's hard in here sometimes.
Yeah. There's lots of interruptions.
Oftentimes can help actually to allow people to rest and sleep better. Anxiety, and all the things that you get when you come into the hospital. It's working in the energy field, the magnetic energy field of the patient. Sometimes it's called the biofield. And what the Healing Touch does is it subtly influences that energy field. And in doing so, that it's a subtle shift, but it has a healing effect and on a physical level as well. So would you be interested in receiving Healing Touch today?
Oh, sure.
Okay. What I'm going to be doing is there'll be times where I'm going to be touching you lightly, no more firmly than this, and there'll be times where I won't be touching you at all. But the entire time that I'm working on you, I will, be present with you. Just connect with you for a second.
Healing Touch has been endorsed by the American Holistic Nurses Association. It's part of their effort to integrate complementary and alternative modalities into mainstream clinical practice. The Nurses Association describes Healing Touch as an energy-based therapeutic approach to healing. Touch is used to influence the energy system, affecting physical, emotional, mental, and spiritual health and healing. The goal is to restore harmony and balance, promoting self-healing.
And I'll continue doing this actually until the energy field feels clear. Healing Touch was developed by a nurse, Janet Menken, and she had been trained in therapeutic touch, which is a curriculum that is taught to nurses as part of the nursing curriculum. Janet Menken went one step further and started to know more about healing, therapeutic touch or healing energies, and pulled a little bit from Bourgeois, pulled a little bit from Rosalie Briere, pulled a little bit from different people, and started to incorporate all of these different techniques she was learning. And when she started to do that, it stopped being therapeutic touch, it started being something different. And she started to call it Healing Touch.
Dr. Stephen Jones is Director of Outpatient Medicine at the hospital and Director of the Center for Healthy Aging. He admits to being somewhat skeptical when Healing Touch was first proposed here, but that's changed now.
We certainly see that people respond better to the standard treatments they have, whether it's pain management, chemotherapy, regular medications, and they seem to relax more in terms of their services, whether it's preoperative, postoperative. So I think there's a clear benefit to the Healing Touch experience for them.
And you release the blocks in the energy fields. Health flows throughout the body.
Healing Touch is now part of patient care in more than 30 U.S. hospitals, according to the national organization that certifies practitioners. In fact, they say Healing Touch has been taught to more than 100,000 people worldwide. It generally takes 2 years or more of training to become a certified Healing Touch practitioner. Greenwich Hospital has 80 Healing Touch volunteers under the guidance of Beth Wright. Laura Sorgenfrey told me she was very happy that it's so readily available.
Did you feel anything when she was working on it?
Yes. I don't know if you could hear it, but it was rumbling.
So I think that's part of getting everything moving.
Exactly. She can get things moving. She did get things moving. And there was throbbing in the hip when she was over on that side. And it's not throbbing now. So.
Oh, how nice.
So it's fine. I'll take it. If it's an hour or 2 hours or 5 hours, I'll take it.
I have no doubt in my mind that to provide quality care, we have to look at the entire person. And as I said earlier, that has to include not just the body, but the spirit and the mind as well. And they're just, so connected that it's almost foolish to think that they're not. We need to make sure that we provide everything we can to enhance the experience and enhance healing for our patients. And there is no downside to doing this, provided it's done professionally and done right. And we certainly push the envelope to make sure that the people that do this are the most qualified, expert in the field, and we do the most appropriate management we can for our patients. So I'm very, very happy with it. And I think as we go into the future, we're going to see more and more of this and more benefits to our patients as well.
Judy, I know you've trained in the field of Reiki, so you've had some experience with energy therapy. Yes?
I have indeed, and I am really a big believer in the efficacy of these treatments.
And I was especially pleased to hear Dr. Stone's positive perspective on the Healing Touch program.
Yes, if physicians like him are seeing the value of it in their hospitals, it's only a matter of time before it becomes much more available in many other places.
That'll be great. Up